Hello world, welcome back once again to an amazing episode of the UnChristian podcast. Please, before we go any further, do me a favor, click the subscribe button. A lot of you are watching. Thank you so much for watching, but you're not subscribing. What's your problem? Please subscribe. Share this video as well to somebody who you know is going to be blessed by it and need it, because as you can see from the title of the episode, this is going to be very riveting, very exciting. My name is Ndumiso Mazibuko. I am the host of the UnChristian podcast, and today I'm so excited. I don't just have anyone here in the studio. And it's guys. And I am so blessed, ladies and gentlemen. Dr. Pastor Zamahlubi Dlamini-Manana is in the house. She is co-senior pastor of Let's Go to Glory Worship Center, where I go to church. Yes, and I am their child, Apostle Manana. You know him. He's been here on the podcast before. And today we are going to talk about something that's close to her heart. And of course, it's in line with her profession as well. We're going to look at the relationship and the attitudes that the church has with mental health. A very difficult, sticky subject for various reasons. And we're going to dwell into all of that. And she recently became a journaled writer or author with that dissertation and that article on this very topic. And so I'm very keen and very, very eager to find out about her insights and all that she uncovered about this thing called mental health and what is our relationship with it in the church and as Christians. Because ziyabuya siyagowa, but asazi ukuthi senze kanjani. So we're going to deal about this. Mom, how are you doing?
I'm well, thank you. Thank you so much for having me on your podcast.
Thank you for coming. Indeed, I really, really appreciate this. I personally have a journey with mental health challenges. Spending a couple of years, but most recently with the passing of my mother, having to go through grief and all of that. And I want to really say a personal thank you, because I think I'm fortunate in this whole discussion. I'm on the fortunate side of it to have had the kind of support I had from you and Apostle and our church family. Let's Go to Glory. And thank you very much. I want to say thank you publicly for all that you did.
It's a pleasure. It's a pleasure.
Thank you so much. Well, mental health, obviously, you started out in medicine as a doctor, then you specialized. What made you say, I want to go the psychiatry route? I want to deal with the mind.
That
and not eyes
is always,
and not feet.
It's always an interesting question.
Yeah.
And for me, I guess it boils down to purpose more than anything, because remember that God gives us the desires of our hearts.
Yes.
So he gives us what to desire. So medicine, I've always known that I was going to be a doctor, that I wanted to be a doctor.
Great.
And for me, it was about helping people.
Okay.
But then as I got to know more about myself and even more about the profession, and I got exposed to the workings of the brain and all of that, I became a lot more interested in that.
I see.
And then like working in different departments and finding myself and realizing that I actually enjoy listening to people. More than listening to people, I enjoy perspective. So not just this person sitting in front of me, but what is it about you that brings you here?
Yeah.
Like, where do you come from? What has contributed to you to where you are right now?
Yes.
And what are some of the things we can do to assist, and what are some of the ways that we can intervene?
Yes.
So for me, I found that I gravitated a lot towards scenarios where I could engage with patients.
Right.
So I prefer to work in outpatient settings. The wards, yes, they were fine, but I found that I felt better in engaging with patients, finding out, okay, post-discharge, how have you been? How have you been coping? What are support structures that are in place?
Yes.
And then I think in that, then I actually realized that, okay, where can I find my feet in a place where I can incorporate that part of me with my desire to help people.
Yes.
And psychiatry, I think I fell in love with psychiatry when I was probably in 4th year or 5th year.
I see.
before I could even complete, you know. So, but I do think that a lot of it has to do with purpose. That I
Yes.
think just God just put it there, and yeah, here I am today.
Yeah, you know, a lot of us from a layman's perspective, when we think of psychiatry, it's just too messy for us. We think of the insane, those who are violent when
Yeah.
they have episodes, and it's just, you know, what are the things that you can correct in our thinking about mental health and mental health care, especially
Okay.
in public sector?
Yeah.
Yeah.
I think, you know, it's actually the same
Uh-huh.
in public and private because the conditions are the same.
Yeah, but we
Right.
think private is bad. And I know it's a lie.
The conditions are the same.
Yeah.
You know, it's just that obviously looking at different policies and laws, like
Yeah.
you can't admit involuntary patients, like patients
Oh.
who are not agreeing to that admission in a private setting.
I see.
There are a few facilities that do that, but most of the time they end up in a public setting
Yeah.
because of that, not
Sure.
because, you know,
Yeah.
of any other reason.
Yeah,
So that's
yeah.
why I'm saying, like, at the end of the day, it's
Yeah,
the
it's the
same. It's the
same.
same practitioners, the same conditions that we see.
Yeah.
But like when we think of mental health, I know that it can be complex and it can be scary, just because of the way that we've been exposed or the way that we've been introduced to mental
Yes.
health, especially before this era, before
Yes.
this generation. It's literally just a study of how the brain and the body work.
Yeah.
It's the study of basically how different conditions that impact the brain are manifested. The same way that someone can study about the heart and conditions that affect the heart are manifested.
Sure.
Because you can't see the heart.
Yeah.
You trust that you have a heart.
Yeah, we
And
just
it's
believe.
beating.
Yeah.
You know, same thing with the brain.
Yes.
We can't see it, but we see the impact
Sure.
of different conditions that affect it. So basically, the field of psychiatry is that in the study of medicine and looking at the different organs and different parts of your body,
Yes, ma'am.
there's this specific part of you, which is your nervous system, that has to do with your brain, which also then has your mind and your emotions and your
Yes.
thoughts and all of those things.
Yes.
That how is the physical aspect, the physical brain, how is that impacting on your mind, which is the part that we can't see, which is
Yes.
basically your soul.
Yes.
So how is it impacting on your emotions? How is it
Yes.
impacting on your thoughts,
Yes.
your feelings, and all of that? And what then can we do? Like, is there a pathology that we can mitigate? Is there a skill that we can teach you to help you cope and deal with that certain emotion better? You know, the same way that if you are having a heart attack, you will experience chest pain.
Yes.
And you'll say to the doctor, I'm having chest pain. It's the same way that if you're experiencing some sort of mental turmoil, you know, you won't know how to express it except maybe to cry,
Yeah.
or to have an outburst, or to scream, or to run around naked. That is
Yes.
just an expression
Yes.
of what is happening on the
I
inside.
get you.
So more than anything, it falls under medical conditions.
Yes.
But obviously now we're dealing with a more intricate part of you,
Yes.
which I think other conditions don't get to, which is your soul. Yeah.
Now, there is a line somewhere where I'm just feeling down.
Yeah.
I'm not feeling okay. I'm feeling lazy. I don't want to go to work. I don't feel like talking to people, just on an emotional level. But
Yeah.
then there's a line where that is a manifestation of a condition.
Yeah.
How do I know that, okay, now this is more than just low feelings?
Yeah.
This is actually depression or
Okay.
anxiety or something else.
So we all have emotions. I mean, we all are a spirit being. We live in a body.
Yes.
I mean, and we have a soul,
Yeah.
right? So the soul part of us is the part that houses our emotions, our feelings, our thoughts, our will, all of those things. We all experience anger, we experience sadness, and it's usually appropriate for whatever situation
Sure.
you are faced with. So a lot of the times when we speak of pathology, then we speak of those emotions being expressed in a disproportionate manner.
Yeah.
So now someone is, so something has happened that has made you sad, but now the sadness is lingering.
Yes.
It's more than just, it's outside of that event that has happened.
Okay.
more than that, it's not just the emotion, but it's the associated features.
Okay.
So now we call them neurovegetative features,
Okay.
like your sleep, your appetite,
Yeah.
your energy, your libido, all of those things
Yes.
are impacted. Then your cognitive features being your memory, your concentration, your thought processing, maybe is a bit slower in the case of depression.
Yeah.
And then maybe you'll start having suicidal thoughts. So it's more than just the feeling, but it's the manifestation and how it's impacting
Right.
your daily functioning,
Yeah.
which is how we classify psychiatric disorders. That in order for it to be a disorder, it must be causing some sort of disorder and disorganization in your life, that you're not able to now fulfill
Right.
your daily duties. You're not able to go to work. You're not able to attend, to your family. You're not
Yeah.
able to even attend to yourself.
Sure.
The moment it's impacting some sort of your functioning, then we know that, okay, there is a problem.
It's not necessarily length of time that I'm feeling this way, or that's a factor.
So there's different conditions depending on what the symptoms you're presenting with
Yes.
are. But yes, the duration does play a role, but it's also what is accompanying that, right? We do have things like prolonged grief, or prolonged grief disorder. We do have things like an adjustment disorder. Then we do have things like depression.
Yeah.
So all of those are different grades.
Yeah.
That there's a lot of gray lines, a lot of intersecting lines, but obviously with psychiatrists we work based on history. So
Sure.
we basically are investigating officers that we'll just dig and see what makes sense, what fits where, what's happening, and then we can be able to advise on what the diagnosis is.
Yeah, all right. Now, when we bring it to the church, an environment where it is an environment known for wellness, we are supposed to be making people well in church. We're supposed to come to church and feel better about yourself. But we got challenges as well as Christians, and there are doctrinal beliefs that says if you feel a particular way, pray about it, cast out that demon, and so on. Before we get into the just basic details and your insights, especially in the paper that you wrote, what are your observations about mental health and the church and the attitude and the relationship there? Yeah.
I mean, I think we've come a long way. Maybe not the longest, but we've come some way. I think that when it comes, okay, firstly, maybe let me just pick up on the reason for me choosing this topic.
Of course, yeah.
So, I grew up in the church,
Yeah.
right? I've been saved my whole life.
Yes. Yes.
I'm not even joking. I have been saved my whole life.
Yes. When you were born, you didn't cry, you spoke in tongues.
Yeah,
Yes.
literally. I've been saved my whole life. I grew up in the church. All I know is the church, right?
Yeah.
So I kind of do know the culture of the church, and I do know how we perceive a lot of conditions or a lot of things that people carry, things that people deal with.
Yeah.
So when it came to this topic, for me, I feel like we can't allow the enemy to dictate to us as children of God how we ought to define and how we ought to deal with different conditions.
Yeah.
And that is to say that if you have a headache, you don't immediately say it's the enemy. Maybe you do, right? But people drink water, sleep, take a Panado, they do something, right? But when it comes to emotional struggles, to mental well-being, we are so quick to say that it's possession, it's oppression, or whatever the case is.
Sure.
If you break your leg today, you're not going to pray it away.
Yeah.
You're not going to say no, cast out the devil.
Yeah.
And you're not going to get a cast.
Yeah.
It's the same thing. Something is broken inside. We can't see it, but something is broken inside. And that thing requires the professionals who are able to deal with it, who've been trained to help you deal with it, right? So for me, it was that thing of like, there is a huge gap, I think, that as a church, we are not servicing in terms of reaching people at an emotional and mental level.
Yes.
But also, it's in my walk with God and discovering that mental and emotional well-being plays a huge role in how we relate with God. That sometimes the things that we deal with and the things that we encounter when it comes to our emotional and our mental well-being, I want to say this in a nice way, some of the things that we deal with, we call them weaknesses, right?
Yeah.
But they affect how we view God. They affect how we interact with God.
Yeah.
Maybe let me make an example. If you are a person who grew up without a father,
Yes.
maybe you will find the concept of God being a father very odd.
Yeah.
Because you have not had that earthly, resemblance of what a father should be.
Yes.
So when it comes to relating with God as a father, you'll feel like, but I can't.
Yes.
Even
and things like surrender. Because in our relationship with God, there's an element of surrender.
Exactly.
Now, when I've had a condition that the pathology is I have to be a control, now it's hard to get into a relationship with God where it's surrender.
Yes, so you have to just completely give
Many
yourself,
things,
So for me, I think it's also realizing that our emotional and mental well-being really is crucial in how we relate with God.
Yeah,
but also it's crucial in how much we can get from Him. Because if you only see God as a provider, you're only ever going to get that.
I get you.
But if you see God as a father, as a healer, as all of these things, but we can't open ourselves up because of all of the things that we carry, all of the things that we've been through, all of the things that, we struggle with.
Wow.
And the devil basically is happy because we are not really achieving.
Yeah. And he capitalizes on that.
Exactly. So he'll use that against you, continue to lie to you and keep you bound in those things.
Gotcha.
So it's, for me, I guess it's the intersection of all of those truths where I just felt like, why as a church are we quiet in this area? Why are we not giving people support? There was a study that was done maybe some time back, and basically they were looking at some of the good prognostic factors with people who are living with mental illness, and actually having a strong religious background is a good prognostic factor, meaning that people who have strong religious backgrounds and have mental health challenges actually do better in the long run. Because of that support and that background and something to hold on to. So now, why are we just letting people be?
I also read, however, on the inverse of that we can mask psychological condition in spirituality. There's that other as well, where we make irrational, illogical decisions, maybe, or behaviors in the name of it is spiritual.
There's things you need to deal with.
It's something else.
Yeah.
But according to your findings, why are we quiet? Why are we silent about this in our church communities?
Because we are just not talking. The biggest
and we don't
part
like
of
talking in the church. We don't like talking.
I think the biggest part of it is stigma.
Stigma.
I think it all boils down to stigma.
Yeah.
Like mental health is stigmatized generally.
Yeah.
Like if you just look at the number of facilities that provide mental health services in the country, right? It's underfunded.
Yes.
And maybe it's not even like a country thing, generally in the world. There is still quite a lot of stigma, even within the profession, right? To mental health challenges, to mental illness. So that also creeps in the church as well, where people are scared. It's easier to label something as demonic than to label something as I need help. It's easier for us to hide behind all of that and sort of just stand back and have an excuse or whatever, than to actually get dirty and okay, how can we help? How can we assist? So I think a lot of it has to do with stigma.
Sure.
But also it has to do with our lack of understanding of mental health.
Yeah.
I think that we don't view it as illness the same way we view high blood pressure and diabetes. Of course. But that also then it means we need to do a lot more education around this to make people aware of what is mental illness, how can it come about, how can you recognize it, how can you deal with it.
Did you have any personal how can I say it, just conflict inside of you on this, because you're a pastor, a church person, and then there's this knowledge that you have?
If anything, that has always been my drive. A lot of people ask me that question because a lot of patients, I think, even when you are a student, that you encounter patients who become delusional. A lot of the times they are delusions around Christianity, and then we say that they are delusional. But maybe because now I've got more understanding of it. But I actually didn't have any conflict.
Oh, that's good.
If anything, I was like, If anything, I realized it was my passion more than anything.
Yes.
That we really need to just stand up as a church.
I get you.
And address these things.
Yeah. How can we as pastors, church leaders, and so on, equip ourselves better?
Yeah.
To be able to help our members, those who come for ministry us in this area. And that's one side of the question. The other side of it, then how does that look like? As church leaders, pastors, handling this right?
Yeah.
What are your thoughts on this?
I think the first thing would be for pastors and leaders in general, just to educate themselves, or even have workshops or whatever it is, where we learn about these illnesses, we learn about what are the different manifestations of these kind of things. I mean, and guys, all sickness is demonic.
Sure.
There's no sickness that's from God.
Yes. Yes, definitely. Amen.
Whether it's physical, whether it's mental, all sickness is demonic.
Right.
But we need to then move away from over-demonizing mental illness to a point where people feel like they are not heard and they can't get help. Even then, they're even afraid of going to the hospital.
Yeah.
So us educating ourselves as leaders means that you read up on these things. If someone says, I've been diagnosed with anxiety, I've been diagnosed with depression, you read up, what is it? What does it look like? How can I support you? How can I help pray with you? How can I, all of those things. So knowing what they are, right? There are mental conditions that you can't pray away. Only. Let me put you can't only pray away.
Sure.
You pray away, but you have to take the medication to be in your right state of mind.
Yeah.
And I mean the ones that distort your reality, right? And yes, we do believe that God can heal 100%. I'm not saying that He can't. But I also believe that healing comes in different ways, that we all are not going to walk the same journey.
Yes.
For one person, it may be a journey of different practitioners, getting help in a different way. For one person, it may be really just God praying and then that's it. But it looks different for everyone. And I think us also appreciating that it's not always going to come the way that you want it to come. Sure. But God does want you well.
Yes.
In every aspect.
Got you.
So educating ourselves about these, and also I think collaborating with mental health practitioners will go a long way.
Right.
So that we're able to identify the danger signs. That if someone is coming and they are saying that they are suicidal and they've had attempts, then you know that, okay, I can't just sit back and call this person in. I need to call someone. They need to be admitted.
Right.
So knowing the things to look out for. If someone is now putting their life at risk or putting others at risk, if they are quite aggressive, they are threatening other people, to know what are some of the things that are danger signs that now we need to actually get this person into a hospital.
Gotcha.
So having those collaborations, I think, can make a huge difference.
Oh, that's great.
And what it looks like, I don't know.
Perhaps it could be setting up a ministry of counseling, or just practical ideas that people can walk away.
But I think that even in Bible colleges, I think they do offer a counseling courses. That I think maybe people who do have the skill of the counseling can then go further and maybe get more equipped, by doing maybe some sessions with other practitioners that can say, okay, on top of you providing the service, these are some of the things that you can look out for. And then having referral pathways, I think, that will then make it easier for that person to get help. Unfortunately, as I mentioned, that mental health is still, we're still trying to find our way. Right? Even our services are not the greatest because there isn't enough resources allocated.
Of course.
There aren't a lot of units the units are not big enough for the amount of mental health challenges that we have. A lot of the times you find that people are waiting for beds, even in casualties, waiting for beds to be admitted to psychiatric facilities because there aren't enough. We haven't increased the number, but the conditions are just getting worse, you know. So we also are dealing with that reality you know, I think the church would also help a lot in, especially like with people who, if we empower you to deal with like people who've got depression and anxiety, empower you to just teach them some skills of how to deal with that and handle that in the day-to-day, that they won't need to then end up in a hospital setting.
Yes. Do you think the NHI will help this situation?
I don't know.
I'm putting you on the spot. I'm sorry.
I don't know what to make of NHI. I don't know with psychiatry if it will make a difference. I haven't heard of
their plans.
Specifically with mental health. So I don't know if it will make a difference.
I get you. We hear of some horrendous stories in the church, like from pastors, where pastors are abusing young girls in the church, where a pastor has just got a toxic leadership style and all of that. Could these be undiagnosed patients?
No.
Without giving them an easy pass. But,
no. Bad people exist even in the church.
Bad people do exist.
I mean, evil people exist everywhere. So I think we should also be careful of labeling everything a mental illness when it's just a person's personality or it's just a person's bad side or whatever. Like it's just an immoral or illegal thing to do. Mental illness and mental well-being has to do with your emotions, your feelings, your thoughts, and how all of that is impacting on your functioning. Mental illness doesn't make you do bad things. Although there are instances where maybe you were not well at the time of doing that thing. But it can't be an excuse for behavior. Like, it can't be that as a leader you've got a toxic leadership style and you blame it on mental illness. At some point you have to be accountable for your actions, because no one held a gun to your head and said do that.
You had a choice. I hear you. What are some, as you were studying, putting your paper together, even your whole specialty program, what were some of your discoveries that even, you know, just blew you away and says, just wow, I didn't know this, and wow, this is important, you know, things that you did include in your paper? Maybe 3 points, that new insights, new discoveries that you had to share with the world from your work.
New. I don't know if there was anything new, but I think the thing that enlightened me was we don't have a lot of work in mental health in the church in South Africa. I think that's the biggest thing. I think as I was busy putting my paper together, there was one study that was published last year in November, similar to the one that I did, was done in KZN. And there aren't a lot of like studies done in South Africa that focus specifically looking at the impact of mental illness, or even just looking at the attitudes of Christian congregants or leaders towards mental illness. Interestingly enough, there were a lot of studies done overseas over the years. Those were the studies that I used to base my arguments on. And in those studies, what they found was that the ones that were done overseas, there was still a lot of stigma. So the attitudes were quite negative towards mental illness. In different countries, you know, in the States, in the UK, there was some done in Ethiopia as well. And they still viewed mental illness as being demonic oppression and all of that. In my study, what I discovered, the attitudes were actually a lot more positive. But that also maybe could have been because of the demographic that I was dealing with. So it was a lot of younger people who had completed school, so they probably have some exposure, you know, to mental illness. But there were also a few people who had personal history of mental illness. And those obviously had a more positive attitude. And then one of the other things that I found that was interesting for me was that knowing someone with a mental illness didn't really impact on the attitude. So it didn't make it more positive or more negative. And and it was like a bone of contention with my supervisors as well, because it's like some studies actually say that it makes them have a more positive attitude, and other studies were like it doesn't really make a difference, and mine was one of those where I would have thought that if you know someone, you've seen someone struggle, you would be a lot more empathetic.
Yeah, compassionate maybe.
But it really didn't change, which was also quite interesting. Yeah.
It's one of the things I got a rude awakening of when, just not being well in certain areas, especially during grief. Just how much forgiveness that I had to do towards the people around me because they just didn't get it.
Yeah.
And you would think that because you're close to them and they have seen your journey and you talk to them, they'll have a better understanding. But no.
I guess it's different when you're on the other side, like when you go through something versus watching someone going through something. Because you don't have that appreciation of, this person actually, like, for someone, getting up and showing up is a huge step, right? For someone who's maybe struggling with depression, and people don't don't appreciate that. They just feel like, okay, you came to work like everyone is expected to do, So I guess it's that. I guess it's maybe something that not just in the church that everyone, I guess, needs to learn, but it's not appreciating the struggles. But also, like I was saying, that mental health challenges look different for everyone, right? So people can have depression, but it won't look the same. There's people who are high functioning and they've got depression, right? But they have other habits that they use to cope with their depression, right? So yes, we may have the same condition, but it's not going to look the same.
Absolutely.
Case in point, adults and children, right? Depression doesn't look the same way in children like it does in adults. So we look for irritability, maybe being more aggressive and all of those in kids. The moment a child starts acting out, for us it's not just acting out because I gave or they're being naughty, but it's like, what is happening? What has changed in this child? So I think it's that, like, maybe we don't really have an appreciation of how difficult it must be for the other person because we haven't lived it. We can, so it's like we can only extend ourselves as far as I've experienced.
Something that we talk about a lot in the church is generational curses, and I won't draw you into a theological discussion about that, but I also learned that psychiatric conditions can be passed down. Is that true? That scares me and worries me, man, because I'm like, I do not want my kids to be going through some of the things I'm going through. So to what extent is that true, and what happens? I mean,
so it is true. There is a genetic disposition to some mental illnesses. Not all of them, to some of them. So, but the thing is, it's not just the genetic disposition that makes someone to then have the symptoms or to struggle with mental illness. There's a lot of things at play, right? It's the environment, it's the coping mechanisms, it's the support structure. All of those things have a place. So, like, you could have someone who has a strong history of mental illness in their family, and they won't have it because maybe they had a good support structure. They've got good coping skills. Their resilience is quite good. They have, like, even if they do experience traumatic events, they don't really cause them to manifest the symptoms of a mental illness. So yes, the genetic predisposition is there.
Right.
But there's a lot of other things that can influence. So if, for example, you have there's someone in your family who has schizophrenia, right? And you may never have it, or you may have it, right? A lot of the times people will get it, especially if they're exposed to cannabis, because cannabis does actually trigger psychosis and trigger schizophrenia.
Interesting. And then some people say cannabis helps you to get through certain things. It lowers your anxiety, helps you to sleep. Can't you say no? Cannabis
is a drug, guys. Like, and don't do drugs.
Drugs are bad for you kids.
That's literally it. So there's a certain strain of part of the cannabis that induces psychosis.
Okay.
That if you don't even know your family history, you don't know who in your family had psychosis, which uncle, which grandfather, from where, maybe one pull is all it takes and you're gone. You know. And you have people who've been smoking cannabis for 40 years and nothing happens to them.
Sure. So wait, are you saying it can induce a psychotic episode or the condition itself?
The condition. It can induce a psychotic episode.
Wow.
But then you must know that the next time,
Sure.
it's not going to be just an episode, you know. So, and then you've got, so one of the things I always advise my patients, like, because, you know, we have like young patients who smoke and then whatever drugs they were using, then they end up with us. If you end up in front of me, it's not a good thing. Like if you do drugs and you end up in front of a psychiatrist, that's not a good thing for you. You might want to stop doing drugs.
Yep.
You know, and one of the things I always say to them, I'm like, you were smoking with your friends, but now where are your friends? You are here now. So you kind of need to make the decision then to be like, your friends can still smoke, or they've been smoking forever and nothing happens to them. But that means that there's something in your genetic makeup that doesn't agree with the substance, you know. So to answer your question, yes, genetics do play a role, but it's not just genetics. So it won't be the only reason that someone will have a mental illness. There'll be a lot of other predisposing factors and precipitating factors that will contribute to that presentation.
I take it other substances, maybe like alcohol, can also,
Most
we can see the same thing.
Most definitely alcohol. And because it's so socially acceptable, it's, you know, like the drug of choice for a lot of people. But like we've seen a lot of people have depression, have psychosis, have even dementia because of using alcohol.
I was shocked to learn that in South Africa, in the world, South Africa is the second highest alcohol consumer. We are only beaten by Britain.
Were you really shocked though?
Not really shocked because I see it, right? But number two, okay, top 10 in Ghana, but second. I was like, I guys, no, there's a serious.
The other
why
thing
isn't it classified as a pandemic?
I mean, who's gaining from it? Should be what you look at. But when you look at the psychosocial status of the country, what are people doing?
Amen.
You know, people are at home doing what? Drinking. On every street corner, there'll be at least 5 taverns. Like if you just drive through townships or drive, like literally there'll be a tavern here, then 5 blocks down, and, you know. So what are people doing? People are just smoking. People are not working. They don't have jobs because of the economic state of the country, you know. And that's where they end up. And unfortunately, we can trace back a lot of, you know, social ills to that, you know, to the abuse that happens in families that people witness, you know, to a lot of other conditions, like even kids who are born with certain mental conditions because of exposure to alcohol, you know, to dementia, to, you know, a lot of other illegal things that happen, you know, people getting beaten up, people stealing, you know, a lot of it can be linked back to things, people getting into car accidents, you know. So it's a problem.
It's a problem.
It is a pandemic, but I think because
even the leaders do partake in alcohol. They take alcohol, so no one's gonna say, because they all want.
Also, it's big business in South Africa.
Oh yeah, huge.
So
huge. Even restaurants, they make the bulk of their profits from the alcohol part.
Exactly. If you watch adverts on TV,
oh man,
half of them are alcohol, you know.
Cool.
So it's for me, I just think it's just basically that, like looking at the impact of whatever. So even with alcohol, you know, anything, even a medical condition can induce a mental illness. So like if you've got thyroid problems, you know, anything that can disturb any functioning in your body can cause a mental problem.
All right.
Yeah.
As we close this off, yes, we agree. When medication has been prescribed, take it and all of that. But coupled with that, there can be some lifestyle changes, some good practices that we can do to aid good mental health. What are some of those things before I run to the sleeping pill? Or I run to Alzan for my anxiety, or I run to something else? What are some of the things you can advise us to just do to keep healthy mentally?
Firstly, get Jesus in your life.
Amen. Hallelujah. Wherever you're watching, if you don't have Jesus.
And
Yeah,
I sound
yeah.
like I'm joking, but I'm serious.
It's serious.
Like, I don't think anything anchors you in life like having God.
Wow.
Because no one knows your struggle like
Yeah.
God does.
Yeah.
Like, no one can understand. You know how the Bible says that we have a helper who knows and who's been through what we've been
Yes,
through, right?
yes.
So even Jesus himself was tried to a point where he was like, I can't, this is too much for me. So you can imagine how much emotional turmoil he must have been in. So honestly, my number one thing would be
Solid relationship with God, a real one.
and the word. You know, because literally from what I've seen, every practice that or every therapy that we implement has to do, like, the word addresses it.
Yeah.
So, you know, we do like types of therapies where we address your thinking pattern, and we basically say change the way that you're thinking so you can change how you're feeling and change how you're acting. And the word already addresses that, you know, that think on these things, whatever is good, whatever is pure, whatever is of good report, think on these
on that,
things,
yeah.
you know. So having Jesus, number one. Secondly, having a good support structure.
Okay. All right.
That plays a huge role, because there will be times where you will face, you know, some circumstance in life
Yeah.
that will be trying. But it does matter who is speaking into your life
Yes.
at
Yes.
that point in time,
Yes.
right?
Yes.
Are you surrounding yourself with people that are speaking life into you, people who are encouraging you, people who are there to listen,
Yeah.
you know, and not just people who are there for a good time only, and when the going gets tough.
Yeah. And
You
some of
know.
our psychological problems can come from relationships.
Yes.
Anyway,
You know.
I get you.
So,
Yeah.
like, you know, sometimes people feel isolated because maybe they didn't form proper connections with people, or they just didn't have people in their corner.
Yeah.
So having a good support structure is key. Having people you can talk to even when you are feeling like very low,
Yes.
feeling suicidal, when you feel like my thinking pattern is not very normal right now, you know, people that you can open up to who can be there for you. Also, guys, the basic things like getting enough sleep. Sleep is very crucial for the brain. Like,
Is 8 hours realistic, ma'am?
it is. I mean, it is.
8 hours.
8 hours is what?
a third of my life.
9 to 6, right?
Perhaps, yes.
It is realistic.
Yeah.
I mean, obviously not 8 hours every day, but like not less than 6.
Yeah.
Like 6 should be your cutoff as a
Absolutely.
human being.
Yeah.
Sleep is very important for your brain because it gives your brain a chance to reset. And it helps your brain to regenerate and create new cells.
Yes.
It helps your body to reset, right? So it's important that you allow your system to shut down
Yes.
and allow your system to reset,
Yes.
because then it's also building your resilience and building, you know, the different aspects of your brain. Like if you were learning things, sleep is where you get to consolidate that information and lay it down. That's why they say you must not cross the night before
Yeah.
your exams.
Then you have a burnout thing. Blackout. Yeah.
You must sleep to lay down that learning, you know, to lay down that information.
Right.
So sleep is very important. It's very crucial, even for your emotional well-being. Exercise or any form of movement, whether it's taking a walk, you know, whether it's running, whatever you can engage in that will get the blood flowing is good for your mental well-being.
Sure.
So get into an activity that you enjoy, whether it's padel these days, you know, tennis for the oldies like us, you know, or soccer, whatever it is that you can, you know, you can do, even if it's taking a walk around the house. Whatever it is that you can do, but get your body moving.
Be active.
It's very good for your mental health. There have been studies that have been done that have proven and shown that exercising is good for your mental well-being. If
my therapist, sorry to stop, my therapist was telling me, showing me how depression makes you to be inactive. But you can break out of the depression if you are not active.
Yes.
And so there's this cycle you got to break out of.
Yeah.
The
So
pathology
literally
of
you
the
need
disease.
to Yeah.
Yeah, break it.
To break that cycle. Because yes, part of it is that it makes you become more fatigued. Some people have hypersomnia, so they sleep a lot more. Some people don't sleep enough, but basically just do something, force yourself to move, to do something, right?
Yeah.
Eating a healthy diet, of course, that is like fundamentals, that is like basic. There are certain like brain power superpower foods, superfoods, brain superfoods that you can eat. So things like fish are good for you. Whatever has omega-3 is very good for you. Not that it treats, but it's just good in supporting your brain functioning. Okay, it doesn't replace. Everything that says replaces is a lie.
Sure.
Can I just put it out there? It helps. It assists with the functioning. Right. And what else am I missing? Yeah, talk to someone. I think a lot of the times, and especially in the church, like how you will come to church, we're all dolled up, looking all put together, and someone may be in the trenches, right? And Umzalana will come and say, "Hi, my sister, how are you?"
Yeah.
"I'm fine."
Hey.
And it's not because you are trying to be closed off. It's just like an automatic thing that, we haven't created those spaces where it's safe enough for brothers and sisters to be vulnerable with each other and just say, "No, actually, I'm struggling."
Should we dig deeper?
Yeah.
With one another?
Yeah. I think we definitely should. But also that culture will start with us. Like it's not just going to start from nowhere, right? We are the ones that are going to have to be open, to allow people to be open.
Yeah.
So, like, the Bible says, for anyone who wants a friend, he first must be a friend.
Yes.
I'm not quoting the verse correctly, but it says something like that. So, if you want people to be open, you have to be open yourself.
Yes. And discretion.
Yes. Integrity. I think it just boils down to integrity.
Yeah.
Like, it's not lebani.
Exactly.
Let's not make other people's problems our tea.
Exactly. Yeah.
And fake concern.
Prayer item. No,
when it's just, it's gossip.
It's gossip. Yeah.
It's gossip that's quoted in concern. It's gossip.
Food.
Let's not do that.
Yeah.
But I think like just speaking to someone, reaching out, there are structures for you even within your church. There are life group leaders, there's elders, there's pastors. Even beyond that, there's like support groups, there's things online, like there's organizations like SADC that have toll-free lines that you can contact 24/7 if you are dealing with something. If you're suicidal, if you're depressed, there's like different groups, anxiety and depression groups, find out what's happening in your community. I like what they do in the United States where they have like groups in churches. So like churches actually host like the Alcoholics Anonymous, the Narcotics Anonymous groups to help people who are recovering addicts, to be in those groups. I wish we could implement that in our churches where people know that, okay, on this particular day there is this support group that is happening. Even like families that have people who've got a mental illness, like at my workplace at the moment, we do have a structure like that where families can come, where they just can interact with other families and just speak on your experiences. And maybe if another family is new to this, how are you dealing with it? How are you living with it? And maybe learn a few things. So like there's different support groups that we can offer. There's different things that we can do. You don't have to be a professional or an expert. You just have to care and have compassion. Yeah.
I heard a statement recently. Someone was saying effective preaching has to also have the element of psychology. You have to address the psyche of the person in preaching. Is that something you agree with? Is that a missing tool maybe, that from the pulpit we gotta reach people? Even you're preaching about, I don't know,
I think it depends on your gifting.
That's the other thing, because you can mess it up.
I think more than anything, I feel like we just need to be comfortable in what God has called us to be and who God has called us to be, like, and not try to reach people in a place we can't, because then we can risk losing them, while trying to find them or have some. I think, yes, preaching does need some level of knowing people, but I don't necessarily think that it has to a level of like psychology or like understanding how the mind works.
Sure.
At surface level, I do think that yes, you do need to understand, how are people able to receive my body language, the language that I use, visuals, all of those things. But like, then just submit to God and allow Him to manifest, like allow who you are in Him to be more evident than what you think or what is the latest thing.
Sure. Lastly, as parents, how can we foster an environment where our kids are growing up in a conducive environment for good mental health? What things can we do? What kind of conversations? What must the home have? Healthy. There are things that we can avoid if there is really a condition that they do have. Okay, maybe, but there are things that there's an environment as parents, things that we can do.
Yeah. Interestingly enough, my son said to me the other day that, what advice would I give kids? And then I said, kids need to obey their parents like the Bible says.
Your son asked deep questions.
And I said to him, what advice would you give adults? And he said adults should listen. So really, I think that is probably one of the biggest ways for our kids to be heard. A lot of times when we see kids, especially once they end up in hospital, kids just need to be heard. I think that's where it starts. That what is happening? What are you dealing with? Who is doing what? If we're not listening, then we're missing a lot, right? Who is this child talking to? Who are they engaging with? What is happening? Because people, like kids get bullied at school, they get bullied in homes. A lot of things happen. A lot of kids are exposed to a lot of other things. If we can just foster the culture of listening to our kids, I think that will go a big way. And as parents, there is a lot that we can do. But I think it's also understanding that a lot of how your child ends up is on how you will parent that child. And for me, I just pray that we understand our kids a lot better as parents, and also to understand, like, to have a way to make them feel heard and make them feel seen. That kids don't feel like they need to bottle up emotions or they need to deal with things by themselves, right? And also not exposing them to like toxic environments. Not exposing them to things that can be detrimental for their mental health, especially when they're much younger, So making sure that we foster that supportive environment, listening to the child, engaging with the child, making them feel like they matter, because things like neglect, they actually do predispose people to having mental illnesses. If the child, there's no proper attachment. So attachment basically means that you have built a relationship with this child, because as a parent or as a caregiver, you will show this child how much they can trust or not trust the world, right? So if you are a trustworthy person, if a baby is crying and that baby is ignored, that baby will eventually learn that no one cares if you cry. You can't trust the world. People don't care. People don't look out for you. And you're raising a child who's going to be closed off, not going to trust people, is going to keep to themselves, never going to say if they're going through things, find their own way to cope, right? But if a baby cries and mom or dad shows up, and every time they cry, mom or dad shows up, they know that people are reliable. People can be counted on. People can be trusted. And that means they grow up building relationships and connections based off of that primary relationship. So for my prayer is always that I wish parents understood how much that relationship really builds this person, how much it contributes to the person that they will grow to become, and what they will be in the society, right? We have a lot of broken people because they were not parented well. I'm sure you've heard of the concept of, the little child or the little boy or the little girl inside, that now we are trying to heal as adults, that it shouldn't be the case.
Sure.
Like, we should be focusing on other things and not healing our inner child.
Is self-parenting what you're talking about, Linda? They call it self-parenting.
Yeah, well,
Now,
like healing the inner child
yeah.
and all of those
Yeah.
things. Like, let's not raise
Yeah.
kids that will need
to do that work.
to be recovering
Yeah.
from their childhood.
Yeah.
You know, let's be intentional about our parenting,
Yes.
not hit children unnecessarily. I know this
Yeah.
is very controversial.
Yeah.
Personally, I don't believe in hitting children. Yeah. But anyways, it's a personal thing. But yeah, but also not letting children just be whatever they want. So obviously building discipline in them, modeling that more than anything, modeling integrity, modeling compassion, modeling listening, modeling caring to kids. Kids don't do as you say, they do as you do.
Wow.
So you'll say to a child, stop doing that, but
Yeah.
you are doing it. They will continue to do it because they see you doing it.
I hear you.
So that's like a big thing, that
Wow.
you can't say to a child, stop shouting, stop screaming,
Yeah.
but you are shouting and screaming.
Yes. Wow.
You know? Yeah.
That's a lot. You've given us so much to think about, so much to chew on, so much to process. This has been insightful. And it challenges us to delve deeper, to learn more, and to have the structures in our churches
Yeah.
where the culture allows for talking, for us being there for each other.
Yeah.
And church is the last place that should be toxic.
100%.
100%. And and so you listening out there, I don't know what you got from this episode. I'm sure if you have questions, please drop them in the comment section. We'll make sure that Dr. Zama gets them. If you do have, contribute. What have your experiences with mental health been? Mental health in the church, mental health with other Christians in the Christian community. Tell us, share your experiences. We'd like to hear from you as well. But this has been fascinating. Thank you so much, ma'am, for being with us today.
Can I just say one thing?
Of course, go for it.
That to anyone who has been hurt in the church, specifically where mental health is concerned, or anyone who has never received help, you know, or has been stigmatized or has been made to feel some type of way, can I just apologize on behalf of the church structure, you know, that we have not been there and shown up for you in a way that matters. But I think it is important that everyone helps the church structure do better. That give the feedback, say what you'd like to see happening, you know. If you need to start that group, the support group, start it by all means, you know. Be the change that you want to see. But like, just to everyone who may have felt like the church never supported you, we apologize on behalf of the whole church structure. You know, and I do pray that going forward we can do better to reach people. And be there for people in a way that matters, and in a way that finds them where they are but doesn't leave them where they are.
And like you said, we are growing in this, we are learning in this, and it's getting better. So there's hope. Thank you so much. Fascinating conversation. Thank you for doing the work you're doing in the community, even in the ministry. This is a big aspect of our beings, and people like you are really helping to change the narrative in the community. And siyabonga, may more resources come to your field, because it is needed. It is needed. Thank you so much. Thank you. Share the episode, subscribe, leave your comment. We'd like to hear from you. God bless you. It's been Dubiso Mazibugo on the UnChristian podcast. Thank you.